hopefully. Hey, this is Danielle from Black Business Boom and Black Owned Nashville, and I am live with the only Black dermatologist in the Nashville area, Dr. Aleta Simmons. And I'm telling you, you are in high demand here in the Nashville area. So I am so thrilled to have you as our industry expert dermatologist and to come to us monthly and answer the questions that we have, especially because it's hard for everybody to get in and see you because you are in such high demand. So I'm excited. We've had quite a few questions submitted this month. So let's jump on in. I'll get those questions pulled up. But as I'm doing that, how are you doing, Dr. Simmons?
I am doing better. I've been away for a while, but I am working on getting back.
Fantastic. And as I told you, take your time. We want you to take care of yourself just like you've taken care of so many of us. So we understand you taking time for yourself and your family during this difficult time. So take as long as you need to
Thank
take
you.
care of yourself. All right. You ready to jump into these questions?
I'm ready.
All right. So the first one is we've seen, I think, a couple times, but this one's a little different. So, how to lighten dark spots, hyperpigmentation on the face caused by eczema. I know I've asked about that question around acne, but for eczema, I assume it may be a little different. So, any tips you can give us on lightening dark spots that are caused by eczema?
That one is a difficult one. I know acne is our go to when we talk about dark spots on the face, but eczema is hard because we have to control the inflammation. We may get acne under control and it stays under control for, years. And it may not cut, it may get to a point where it's not coming back and we can come off of treatment. Whereas eczema in some people can be, lifelong. We see children that grow out of it and their skin heals and gets better as they get older. But eczema that persists into adulthood can be tricky because that constant inflammation is going to cause the hyperpigmentation or the dark spots that people see. So getting a good plan and regimen in place is going to be the first step so that you know what to do when you see those first signs of an eczema flare starting. And once we get the inflammation under control, we can start to think about maybe some gentle things that we can do in order to address the hyperpigmentation or the dark spots. But the medications that we often use can be irritating. Irritation on eczema prone skin can lead to more flares. So we have to be really careful. So you want to see someone who has experience with eczema and products to know when it's okay to start trying to do some further skincare outside of eczema control, because what we don't want to do is worsen it.
Fantastic. Great. Thank you so much. Let's move on to our next question, which is about hair thinning. So, Denise has a question. How do you address hair thinning that hasn't occurred because of chemicals or stress from braids or pulling? So, I guess Denise is asking if you have hair thinning and it's not because of chemicals or from hairstyling, what are some ways that you can address that hair thinning?
There are lots of different things that we can do. So, first, we take a good history to see what other things could be causing it. It could be a medical condition, it could be medications that you're taking, or it could be genetic or hormonally driven, like female pattern or male pattern baldness. So, we kind of need to do some further investigation to tease through what else might be contributing to that hair thinning outside of braids and chemicals or traction alopecia.
Okay. And that's a great transition into the next question, which is what are some recommendations for alopecia?
So it depends on the cause. So you first need to see someone who can help you with your hair loss, get a diagnosis. We often, after we take the history, we'll do a scalp biopsy. And it's a very small, like probably the end of a pencil eraser size biopsy that we take to look at underneath the microscope and see what may be causing the hair loss, right? If we need to. And that can guide us in our treatment. So you first need a diagnosis. Once you've been diagnosed, then we can come up with a plan to address your hair loss in the right way.
Okay. And so Joseph took that question a little further and asking like his alopecia or someone in his family, I assume alopecia has taken all the hair on the head, body, and beginning to affect the facial hair.
Okay.
So is there anything that's making you think that anything additional he needs to do about that sort of alopecia?
Definitely. We call that alopecia universalis, where people can lose all of their hair from head to toe. And that we want to make sure we look for things that may be going on internally. Some people with autoimmune conditions in their family or that they deal with personally can be correlated. So we want to do a good check, like checking the thyroid, for example. And so then most people will want to try oral medications in
Mm.
order to see if the hair will grow back. We have medications called Jack kinase inhibitors that have been used in this condition, and there are lots of medications that are being investigated right now because as you can see, something like that can be debilitating for a person to lose all of their hair. So there are lots of clinical trials and medications coming down the pipeline to see if we can better address it. But
Oh,
definitely get in to see at least your primary care physician and to start the workup. And then they may send you to other specialists like dermatology, endocrinology to do some
mm.
further investigation.
Love it. Wonderful. We had a couple questions about HS. I'm not going to even try to pronounce it, but I'm sure you know what I'm talking about. But I
Yes.
was sitting here like, I'm not going to even try this one. So we had a couple questions about HS and any treatment options. And then someone asked, is it in the family of parasites or infections? So can you tell us a little bit about HS and any possible treatments for it?
That's a great question. HS is hidradenitis suppurativa. It is not related to people having parasites or infection, but it's inflammation in the skin, right? So we're coming right back to inflammation. A lot of our skin conditions are due to inflammation in the skin that's attacking a certain part, causing the symptoms. So patients with HS, there's often a delay in diagnosis because it can affect areas that people aren't prone to readily say at the doctor, hey, I'm getting these bumps, under my breast, in my armpits, in the growing. So telling your physician early is key and coming up with a treatment plan. Right now, we usually will start patients on antibiotics and give them a trial. But when people are, a lot of times I see, especially my Black patients, Black women are affected mostly by this disease, coming in later where their disease has already progressed. They're in their 30s and 40s. They've had it since they were teenagers, but they were never properly treated. So then we have to think about other options. Humira is a good option. I'm not being paid by them to say that, but it works on the cellular targets that are causing and driving the inflammation leading to the disease. So you definitely want to get in. We use a multidisciplinary approach, working with your primary care doctor, your dermatologist. We may need to refer you for certain procedures. So having a good care team is going to be important because you're going to need frequent and close follow up.
Fantastic. Love it. All right. We have another question about alopecia. Someone has chemo induced alopecia. Is there anything that can be done to reverse it, or anything that they can take to help reverse that?
So chemo-induced alopecia can be challenging to treat. The medications have cut off hair growth in a certain cycle of the hair growth process. And so that hair sheds. And oftentimes, some people will have their hair grow back with a different texture. It'll be
Mm,
thinner than what it was prior to chemo. And sometimes that hair um, is slow to grow back or often doesn't grow back at all. So again, that's something that we like to follow and treat in office um, to see exactly what's going on with your scalp and come up with a plan.
okay, fantastic. Let me ask you, and we have two more questions we'll get to real quick, but I want to ask you because, of course, we know that you are in high demand in the area. And I know you mentioned that we have some additional folks that are in training that'll probably have a good understanding of treating Black skin. But is there anyone in your office right now that you would refer folks to, or you tell them, would be a good fit and really understands melanated skin?
Well, I would say it also depends on the condition. So we have physicians who specialize in cutaneous T cell lymphoma, which for Black women can be, Black women can present later and have worse prognosis or worse outcomes. So we do have two physicians in our office who specialize in that condition, and I often will refer my patients to them if I'm concerned about it or if I've diagnosed them with it. So if you've been diagnosed outside of the Vanderbilt system, those are key places. And then we do have two people in our office who do medical dermatology. So it really depends on, what you're coming in for. But I will say I do see the bulk of our skin of color patients in our clinic. Um, so if somebody has like specific diagnoses, I can refer that way. So yeah, I think it just depends.
All right, fantastic. Let's get to these last few questions. All right, so Chelsea has systemic lupus. Do you think that she should see a dermatologist regularly?
Now, for systemic lupus, I would say you don't need to see a dermatologist regularly unless it's starting to affect your skin. Sometimes people with systemic lupus can also develop discoid lupus, which oftentimes affects the hair and the scalp. There will be involvement in the ears as well. So if those things are coming up, definitely. But people can have systemic lupus without having a skin component. And some people can have lupus that just affects the skin and does not affect the internal body parts. So if you're starting to notice things on your skin are different, or you're more sensitive to the sun, which can be very common in systemic lupus, it's best to talk to your physician, your primary care physician or your rheumatologist to come in and see a dermatologist and wear your sunscreen regularly and avoid the sun.
Fantastic. And so dark circles, Jesus Christ. So I had
We all
so
have them.
yeah, I know. I'm like, I had to throw a little concealer on myself, so I understand. But Kelly says she has dark eye circles. Any recommendations to lighten them?
So that's another thing. Diagnosis is important. So I always ask patients, do they have a history of allergies, eczema, or asthma? Because sometimes, if you have allergies, you can tend to, your eyes are itchy and you tend to rub. That can cause what we call allergic shiners. And that's a little bit more difficult to treat than, let's say, hyperpigmentation for other reasons. And for patients who've had hyperpigmentation, for years that may be stubborn, I do a prescription medication that I have compounded at John Hollis Pharmacy to try to lighten those areas with a combination of hydroquinone and other skin lighteners. So it depends on the cause. Also, people with dark circles may benefit from some filler because the hollowing of the eyes due to loss of volume may cause shadows around the eye. And that filler, just putting in some more volume, can help brighten the eye area as well.
That's great. Fantastic. Don't be scared of fillers, people.
Use them with caution.
I was like, black cracks a little bit, and we can fix that with some fillers.
Exactly. Just go to someone who has experience with filler.
Fantastic. Yes. I mean, they're injecting something in your face. So you definitely want to be careful
Yes.
who you choose. So, we have one last question, but there's one comment here that I was like, I feel like this is something that we hear a lot. I didn't know we needed sunscreen. A lot of Black folks don't use sunscreen, don't realize that they really need to, since a lot of us don't necessarily burn or peel. So can you give us any of your thoughts around sunscreen and melanated skin and why it's important?
So sunscreen for Black people is going to be very different than it is for lighter skin tones. So for us, it's definitely anti-aging,
Mhm.
preventing burning when we're outside in the sun, and helping dark spots. So wearing sunscreen alone, especially sunscreens with iron oxide, can help dark spots not get darker.
Mm.
And as you're treating your dark spots, you want to be diligent about wearing sunscreen because it's going to help with that lightening process, right? If you're going to be out in the sun, you definitely want to protect yourself with, wide brim hats and sunscreen, because if you don't, all the work that you've done is going to be undone just sitting out in the sun. The sun is just going to make those dark spots come back. We are less likely to get skin cancer in comparison to white people. So when we were wearing sunscreen, it's not the main priority of, I need to
Yeah.
prevent skin cancer. And especially with melanoma, because when we tend to get melanoma, it's called acral lentiginous melanoma, found on the hands and the feet. And there hasn't been a strong correlation with sun exposure in those types of melanomas.
Mhm.
So I think our primary cause of wearing sunscreen, sun protection, anti-aging, and helping with dark spots. Um, and less likely the big concern of developing skin cancer, since we are not found to have skin cancer as as prevalent in society.
Fantastic. All right, our last question, and this is a good one, in my opinion. What are some ways that you can treat or clear acne without medication?
Some people's acne gets better with just having a good skin regimen. I sit down with my patient and ask them, what's your skin type in terms of normal, oily, combination, dry. Once you know that and you choose products that are made for your skin type and washing your face morning and night, you can start to see changes in your skin with just having a good skin regimen. Now, if your acne isn't better with just a good skin regimen, that's when you need some sort of medication, whether it be over the counter or prescription strength.
Fantastic. Get your regimen together. We've talked about that before. Wonderful. This was great. Thank you so much for joining us again. I'll get some questions round up for us for next month, but these were wonderful questions, and I'm sure they were really helpful to everyone that joined us. So again, we appreciate you so much for taking the time to join us here in this forum and help get some questions answered. If you have any questions, make sure you drop them here on this recording, because I'll come back and reference them and make sure we get them in next month. Thank you so much, Dr. Simmons.
Thank you for having me.
Absolutely. Take care of yourself. We'll see you next month.
All right.
All righty.